I had heart surgery yesterday. Let's talk about it. Hi darlings, my name is Robin Hahn and I have EDS, a genetic connective tissue disorder that affects a whole bunch of different systems in my body because, connective tissue is everywhere. It's a lot, and I have discussed it in previous videos, which I'll put in the card, but the relevant thing here is that it is energy limiting. So alas, I have no time and no spoons to make this one of my tightly edited video essay type deals because I had heart surgery yesterday. And I have 4 shows. So this is gonna be sort of like a chatty, vloggy thing, I think, because I've been getting a lot of questions about it, and I've also been promising a big heart update, and this is it. So here we go. Before we begin, sort of obviously, this video is gonna have a lot of talk about medical stuff. So if that's not your bag, if that's not the type of video you wanna watch right now, totally get it. I will see you another time. You can go explore any of my other videos. First, an update on my heart. In my previous video on my heart, I said a couple things that I want to clarify, I think, because it was new and I knew nothing about it. And since then, I've literally been looking at so many ECGs and so many heart monitors and Holter monitors and tests and all of that I know a little more, But not everything is going to make total sense if you haven't seen the first heart video that I posted. So if you're here for that news, then I recommend going to my previous What's Wrong with My Heart video, watching that, and then coming right back. Links in the doobly-doo. If you're just here for the explanation of what my cardiac ablation was like, though, no worries. You can just skip to that part. I'll have timestamps along the bottom of this video to get you there. As I mentioned in the previous video, without medication, I have about 19.5 thousand PVCs a day. That's a heartbeat that is interrupted by a second electrical signal, interfering with the heart's ability to beat normally. Your heart gets really confused and the heartbeat often feels canceled out, basically. Now, my understanding at the time was essentially that it completely sort of canceled out that heartbeat and made it go sort of flop around like a dead fish. I did it like a funny little blah, blah, blah. And kinda, but also having seen a lot of my ECGs now, I now also know that you really do see the added electrical activity. So really my heartbeat, instead of disappearing, it's boom, very big. It looked like this. Yeah, so I'd call it more the heart goes blah, 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 or rather the electrical activity. I don't know what your heart does, but that's what the electrical activity in my heart does. So yeah, I'm not dead. I'm more electrified. I also said that my meds weren't working super well at the time, and over time I did find that the meds did help. I was on a type of beta blocker called metoprolol. Beta blockers are a class of med that are frequently prescribed to people with abnormal heart rhythms, which definitely included me, but they didn't make it go away. They just sort of made my symptoms less. They were not there. The other thing that they helped with actually a lot were my tics, which apparently is quite common in people who take beta blockers and have tics, is that they cancel out a lot of your tics. This is actually a concern of mine now because now I'm off the beta blockers because I've had this heart surgery. We'll get there, but yeah. So I liked the beta blockers I was taking, but I liked the opportunity to never have to take a med about this again. Even more, right? One more update. Since then, my rheumatologist has been writing down on her referrals and stuff that I have POTS. And I didn't know this. I found this out when a doctor told me that was in their referral from another doctor. No one told me I had POTS. POTS is postural orthostatic tachycardia syndrome. It's a very common comorbidity with EDS, and it means generally that your heart rate elevates too much when you go from lying down to sitting up. Standing. Now, my cardiologist was initially reluctant to diagnose me with this because while my heart rate did jump, the first time she tested, it wasn't enough to call it POTS. And the second time, what happened is that when I stood up, I just got more PVCs. So it was sort of obfuscating the POTS-ness, but I have been reporting back to my doctors that, using compression socks and compression stockings helps a lot. Drinking a ton of liquid helps a lot, and eating a lot of salt helps a lot too. Those are all real common in POTS. So I guess I have POTS too. But this surgery can't fix POTS. POTS is really sort of like a vein problem as opposed to a heart problem. So this is just for the PVCs. But update, do in fact have POTS. After all that nonsense. So that's all my heart updates. But how did I get to surgery? Well, literally right after, my normal cardiologist and I did this POTS test where I stood up and my PVCs went through the roof. Oh, I'm not allowed to sing. Again, we'll get to it. The surgery stuff. She was like, okay, so you're on beta blockers that are supposed to stop these from happening. and they're still happening, I'm gonna send you to like an arrhythmia specialist. Now, PVCs are not like a true arrhythmia because a true arrhythmia means that like the whole beating rhythm is completely not correct, whereas a PVC is a problem with individual beats. So most people who are having a lot of PVCs will have like a PVC, normal one, and then a normal one, and then a PVC or something like that. 1 every 3 is called trigeminy, 1 every 2 is called bigeminy, and then there are, you know, just individual. What does that make sense? Does that make sense? Am I making sense? I don't know. They pumped me full of a lot of narcotics last night anyway. But yeah, like it's an individual event that I'm just having a lot of. But there's a reason that you would be sent to an arrhythmia specialist anyway. So I got sent to this new cardiologist. So he's like my second cardiologist because that's the sort of life I lead, where you have multiple cardiologists anyway. And he did more tests. He sent me for like a whole heart MRI, wham, bang, boom. Oh my God. It was so much. It was so much. And it was at like 3 in the morning and they had to try to put an IV in me and my veins just like run away when you try to poke them. And they're small and they're deep. It was a whole adventure. So he sent me for a whole bunch more tests. And I came back and he was like, yeah, I think you are a candidate for cardiac ablation. What is that? Cardiac ablation is a very minor heart surgery. So like, did I have heart surgery yesterday? Yes. Did they crack my chest open? No. That's why I'm here, you know? I'm at home. This is not a hospital. It's a very common surgery for patients with atrial fibrillation, which is a more common and like also like real arrhythmia. It's the exact same procedure, just done on me. So here's what they do. They go in through the seam between your torso and your leg. If you need to get this procedure, you're gonna need to shave some stuff. They go in with a tiny, tiny wee little like needle thingy. Actually, I have no idea what they go in with. Something small. It's itty bitty. Anyway, they go in and they find a vein, a big vein, a specific vein, whose name I've forgotten. And through this vein, they go all the way up into your heart on the inside. And from there, they pinpoint exactly what part of your heart is the source of the problem and zap it with a laser. No, I'm not kidding. They fully go inside your heart from a vein and zap your heart with a laser. Ah! And then they come out. It's a really short process, 2 to 3 hours. Mine was only 2. Again, I'll get to why. They don't normally even leave a stitch. I got a stitch because I'm a singer and I need my abs to sing, but it's very, very non-invasive, which is why it's an outpatient procedure. That's the sort of basic rundown of what this is. So, what happened when I got it? First of all, I knew going in that I was not going to get intubated, and I'm not sure how common that is. Like, did they just do that for me, or is that normal? Why would I think they would have just done that for me? Well, intubation can really mess up your vocal cords and get you super bruised, and so they don't like to do that to singers. My second cardiologist, the one who was actually going to do this surgery on me, knew I was a singer and immediately was like, we're not intubating. We're going to give you a stitch so you can sing faster. He was so good about it. So I don't even know if that's normal or if that's just what he did. So I asked, okay, so what kind of anesthetic are we doing instead? And they're doing a type of anesthetic that's supposed to leave you in this like Twilight Zone type deal, right? I'm like, well, people with EDS, you know, sometimes we have interesting reactions to anesthetic. But again, my anesthesiologist came up to me and he knew about EDS. He asked me which subtype I had. So he knew his subtypes and everything. And therefore he knew that I may have altered reactions to his anesthetic, which was great. First of all, sorry, I totally had forgotten this part. Before I had this procedure, I was not allowed to eat or drink even water starting at midnight the night before. Now, if you have POTS, which again, I apparently now do, you know that drinking water is like your lifeblood, right? The more blood volume, the better, because if your veins are not good at compressing to send your blood around your body from your feet to your head, the more blood volume you have, the more liquid you have in your body, the more easily blood can get sent. So I was concerned a little bit, but once they got the IV in me, again, a whole other adventure, but did work on the inside here, right here. They did tell me they'd administer some saline through that line as well as the anesthetic, so at least there was that. Okay, so I was mostly set up for the procedure, and then they did an ECG. Now, a week before surgery, I had been told to get off my metoprolol, because to do the surgery, they have to induce more PVCs. They have to make sure that they see them so that they can see where they're coming from, right? So they do an ECG to like check what's happening. I was in trigeminy, meaning 1, 2, blah, 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 1, 2, blah, 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 1, 2, blah, 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 blah. So they're like, oh, okay, well, that's not gonna be too hard to find. In fact, literally one of my nurses said, oh, look at these puppies. Let's blast them with a laser. Anyway, I have my IV in and they sort of wheel me over to the OR. And the OR, at least where I had it, had this massive flat screen, truly enormous, hanging from the ceiling, ready to display like all my heart stuff. And I was like ready to just sort of transfer and go into the like surgery bed and whatever. And they're like, no, wait. So if you've had an ECG before, which if you're watching this because you like are going to get a cardiac ablation, maybe you've probably had them. You know, they stick you with all those stickers, right? Still got some glue there left from a few of them. So they put the normal ones on and then they're like, roll over. And on my back, I swear, they put like 5 to 7 massive stickers. Massive, like enormous, probably so that they could stimulate the PVCs, I guess. I don't know, but like I felt like a kid's coloring book, I swear. Once I was there, I got all set up and then I remember going to sleep. And by going to sleep, I mean going to sleep. Like my first thought when I woke up was, did I have a nap on them? Oh my gosh. No, it was over. So twilight, right. Apparently I did wake up for a second in the middle. I don't remember it. But again, like it's twilight anesthesia. So like waking up is sort of part of the vibe, but tells me that he probably put me down a little lower, knowing I have EDS. Good thoughts. But the nurses around me commented immediately on how alert I was. Like as soon as he had turned it off, I was like awake. And when I woke up, there were these really cool 3D images all over the screen. And I was like, oh, what is that? And they said, that's your heart. So I asked, okay, what are all these dots in different colors on the side of it like that? Because there were these like red, orange, blue, and white dots around the top in this sort of shape. And they said that is where they had zapped. And the colors are the computer telling them like if they're hot or cold. So literally blue is cold and red is hot, like the children's game. Delightful. 10 out of 10, no notes. It felt really quick and they wheeled me back out. Couple things that surprised me. First, despite the fact that it makes perfect sense, it never occurred to me that my heart would hurt because they had zapped it with a laser. It's not like chest pain, because chest pain sort of feels sort of general, right? Like it was like inside on my heart. Yeah, like it's super normal. And that's what they were saying. And I didn't worry me at all. It just didn't occur to me that that would make a lot of sense. That after you burn your heart, it will hurt. Anyway, so that was a surprise to me. And then they did an ECG again when I was done. And it looked like this. Now, you don't have to know how to read an ECG to know that my first one and my second one are super different. Like, whoa, it is squeaky clean. Not a PVC in sight. Gone. Now, the thing with a cardiac ablation for AFib is that it's not uncommon for cardiac ablations to need to be redone for AFib over time. And it is extremely uncommon for that to happen with PVCs. If it works, it cures it. Since then, I have not had a PVC as far as I can tell. I mean, I couldn't always tell when I was having a PVCs, but they're gone. No PVCs at all. That's a big deal for me, you know? After the surgery, you have to lie down for 2 hours. And by lie down, I mean lie down like they won't let you move your leg, the leg that you got the incision on. They won't let you lift your head, none of it. My delightful partner came to my bed and read me facts from the internet for 2 hours, and I got something to drink. I didn't feel as dehydrated as I thought I would because, of course, they give you quite a bit of saline to make the operation go, but still it was definitely not at my normal levels. So I tried to get a lot of drink and they're like, sip, not guzzle, because apparently if you guzzle with all the medications that I was on for the anesthesia, it can make you really nauseated. So as much as I wanted to scarf it down, I couldn't. After 2 hours, they sit you up and then you can have more water and some snacks. Hospital snacks are not great, and particularly if you have food restrictions like I do because chronic illness. So I just brought my own. I found that I was very hungry but couldn't eat a lot. So I ate an apple and like 2 bites of a granola bar and it was like, oh, felt very weird after that. Had to get up and walk around, went totally fine. And then I found out, well, I had found this out before, but then it became relevant, that the painkiller they give you is Tylenol. Now, this is not a super painful procedure. Like really, there's one little cut down here and then like a little area that goes bzz, bzz, bzz in your heart. There's not a lot of pain involved. So Tylenol really should take care of it, except Tylenol does not work for me, like at all, like no effect. I've never had T3, so maybe it's like a diminished effect and it's just not enough to show in normal Tylenol, but T3 is not what they wanted to give me. They wanted to say take Tylenol. So I said, not gonna work. So they looked through my medications and my current painkillers, and most of the painkillers that I take can cause bleeding if you have had a surgery. But they discovered that my migraine medication didn't. So they said, well, just take your migraine medication. Of course, my migraine medication is super expensive, but I only have like 2 more days of needing to take my migraine medication as a painkiller. They gave me a non-commercially available one, while I was there, so it was fine. I did get 1 free dose. Woo, party! Yeah, within seven hours of leaving the house for heart surgery, I was back home. It's not that long. Now, having heart surgery is not the only way to manage PVCs. There are stronger drugs that I could have gone if I didn't feel like I was prepared to do a surgery. It's not the only way, but it was the way that I chose. And at the moment, I regret nothing. I mean, I have to take it easy. I'm not allowed to lift anything heavy, and I am not allowed to sing for a week. Yeah, because they literally go in like around your abs, right? Like if you push on your abs, you can push open the incision. So like, don't. But I'm feeling good. When I woke up this morning, I found that while I still wanted to like lie down in the morning in the way that I always have for like a solid hour, I could get up during that hour and like walk around. I had more up downs and less weirdness about it already. Amazing, mind-blowing, astonishing. I'm curious to see how much more energy this gives me, how many more spoons I get out of this, so I think it will be tangible. Astonishing. I'm so happy I did it. Is my POTS cured? No. Am I sore? Yeah. Do I wish I didn't have to pay through the nose for basic painkillers when I have a condition in EDS that causes a lot of pain? Yes. But I regret nothing. I'm super happy, friends. This isn't the end of heart stuff or circulation stuff or dizziness or tiredness for me, but it's the end of that source of it. And that in and of itself is tangible and cool. When you have chronic illness, you are managing your body every day. Every moment of every day, you're managing it. It's a continuous process. And within the chronic illness umbrella, to have something that you can just fix is like winning the chronic illness lottery. That's genuinely how I feel. I won the chronic illness lottery, that it's just gone. That's my heart update, friends. You're unlikely to hear from me for a bit because of all of these shows. I'm so sorry. I love you all, but like, oh, I will make a new video when I can. I'm really hoping to do another opera profile soon because I loved making my last one and I want to make more. And I think I know who I want to do it on too. So in the meantime, feel free to follow me on Instagram. I'll probably have a few more updates over the next few months over there. And as always, if you were looking for a joyful little corner of the internet where we could discuss opera, disability, queerness, cats, and tea, you have found it. And if you weren't looking for it, you have found it anyway. So go hit that subscribe button and ring the little bell. Keep the comment section full of joy and light, and I will see you in my next video. That is a really harsh blush line. Whoops. Oh, look, I did the North American one. Editor Robin here. I just feel like I needed you to know that this is the light in which I edited this video. Gosh, this is why I always script my stuff, because I'm such a scatterbrain. Now you get to see it.